In this video, I'll be talking about the second subtopic under pain, which is measuring pain. In the last video, I've talked about types and theories of pain, in which types of pain we looked at organic and psychogenic and acute and chronic, whereas theories of pain we've looked at specificity theory and gate control theory. So in this video will be the second subtopic, which is measuring pain. So when you're writing your descriptive essay, you need to include 4 things. I don't know why it's labeled ABBB there. It's supposed to be ABCD, okay? So look at self-report measures, psychometric measures and visual rating scales, behavioral observational measures, and pain measures for children. So this is the most common method used in measuring pain, which is self-report, in which there will be an interview done by the practitioner, health practitioner. So it's a self-report technique involving a dialogue between practitioner and patient to help with diagnosis. This can be in the form of semi-structured or unstructured interview. Patient is able to elaborate on their symptoms and describe it in your own words. So, for example, when you go to the doctor and the doctor will ask, what's wrong, where is the pain, when did it start, okay? So it can be semi-structured or unstructured interview. Now, at times, practitioner can need the help of such pain assessment tools to help diagnose the level of pain, where the patient can indicate on what scale they are, okay? However, there are problems with such tools. Okay, for example, yesterday I asked you to put a measure in your pain level, okay? Now let's focus on the wide area, okay? Most of you wrote down stubbing my toes, and as you can see, some of you perceive it as level 3, and some of you perceive it as number 7. So as you can see, it is subjective. Different people might have different pain tolerance. Some might find it not that painful, but some of you found it really painful for you to label it as level 7. Okay, and here, this is the worst pain possible ever, and you have written down a few, okay, from constipation, migraine, gastric, and giving birth. Most of you wrote down giving birth, okay? So what's wrong with such assessment tool? It's the fact that it is subjective. Different people might feel it differently. Different people might have different pain tolerance. So there's individual differences there. So we can't really use it. Okay, for some people migraine can be a 1, but for some people migraine can be a 10. Okay, it's not consistent. The second method is psychometric measures. Okay, psychometric is basically pen and paper. Okay, so here it's what we call McGill Pain Questionnaire, which has 4 sections. Okay, so first thing, they will ask you the location of pain. Okay, so there's a diagram of body where patient can mark location of pain. So this is on a piece of paper. Okay, so first they have to determine where is the location of pain. So let's say it's here. Okay, and then they move on to the second section. What does your pain feel like? Patient has to select one word from each of the 20 subcategories to describe pain. Okay, so for example, I see this diagram. Okay, so then I have to pick one from each section to describe the pain that I'm feeling. So let's say here. So I'm choosing these words. Okay, and then you move on to the next section, in which the question says, how does your pain change with time? Is it continuous? Is it steady? Is it constant? Is it periodic? Is it intermittent? Or is it brief, momentary, transient? So they have to pick one, okay, from each. And then there are some open-ended questions. So what kind of things relieve your pain? What kind of things increase your pain? And how strong is your pain? That's the final section in this questionnaire. How strong is your pain? Rating scales to describe the current pain and compare with previous pain experience. Okay, here they have to fill this in. Okay, I don't think you have ever encountered this questionnaire in Brunei. They don't really use this. The most common method is basically that self-report measures now, which is interview, okay, with the help of that pain assessment tools. Here, and you've never encountered this in Brunei, I think. Another way to measure pain is using visual rating scales, specifically visual analog scale. So it's used over continuum of values. Patient marks point on 10 centimeter line, so there's a 10 centimeter line with descriptors at either end showing alternative ends of the spectrum. Okay, then the doctor can measure this. Okay, so this means that your pain is around 63%. Okay, so this is compared to 1 to 10. Okay, this is more towards, this is more value, which is 100. It can go from 0 to 100 if you change it to percentage. Okay, another method is behavioral observational measures. Behaviorists believe that we should not investigate subjective feelings. Okay, as I said just now, different people have different tolerance for pain, but should consider only observable behavior. Behaviors have noticed that people tend to behave in certain ways when they are in pain, such as complain, gestures, holding your stomach, and postures or not being able to stand straight. And from this finding, have designed pain behavioral scales. On such scale, it's called the UAB Pain Behavioral Scale, consists of target behaviors, so the body language of the patient, the mobility of the patient, posture, and so on. The observer has to judge how frequently each behavior occurs. So who judge them? Okay, it's usually the nurses. Okay, the nurses. So for example, it's a admitted patient. So the nurse will observe the behavior of the patient and then write it down. Okay, so specifically UAB pain behavioral scale is only interested in behavioral features. UAB records frequency of various measures such as body language, vocal complaints like okay, it hurts, grimaces, your facial expression, mobility, etc. Scoring is done by clinician, and each time it is undertaken, a score out of 10 is obtained. Now I want you to have a look at page 243 on your textbook. Okay, so there is a diagram there, UAB pain behavioral scale. Now let's say number one is vocal complaints, so verbal. Now take a note that in your textbook it is the other way around. Okay, it's actually, if it's none, it's 0, occasional it's 0.5, that's correct, but frequent should be 1. But in your textbook it says none is 1, frequent is 0, which is the other way around. This is the correct one. Okay, because the higher the score, the more marked the pain associated behavior and the greater the level of impairment. Okay, so it should be, if there is more frequent verbal complaint, non-verbal complaint, standing posture, it should be higher. That means they are in a greater level of impairment. Okay, now, so let's say there's a patient and then the nurse is watching, is observing without the let's say without the knowledge of the patient. Okay, so let's say this is the scale just now, this is what is here on the clipboard. Okay, let's say the first one is vocal complaint, verbal, it's frequent, so I mark 1. Non-verbal complaint, frequent, I will mark 1. Downtime, none, 0. Facial grimaces, 1. Standing posture, normal. Mobility, no visible impairment, so I wrote down 0. Body language, frequent rubbing side of pain, let's say. Use of visual supportive equipment, let's say dependence, so I'll mark 1. Stationary movement, I'll mark 1 because it's constant. And position shift. Medication, always demand for increased dosage, so I mark 1. So in total, it's 7. So which means he is in a great amount of pain. Okay? Because the higher the score out of 10, the greater impairment it is, the more pain they are in. Okay? And the last one is pain measures in children. So the first one is Pediatric Pain Questionnaire, which is developed by Varney and Thompson in 1987. It's a multi-dimensional questionnaire. Okay, so it's psychometric test, but for children. Okay, for assessing pain in children with separate forms of patient, parent, and clinician. So it's the same as McGill Pain Questionnaire just now. That's what MPQ stands for. It measures perception of pain intensity, location, affective factors, etc. Young children can use colors and descriptive items for adolescents. So different forms for different ages because it depends on the language capability for each age. Okay, the older you are, the more complicated the words are. Okay, sorry, excuse me. Okay, so let's say like MPQ just now first. Okay, sorry. First, they circle the words that best describe their pain. Okay, so they have to pick 3. So let's say here squeezing, horrible, grabbing. Okay, and then the child is then asked to rate how they feel at the time on a continuum. Sorry. Okay, as well as rating the worst pain they had this week on the same scale. Okay, so let's say here they report their pain as their sorry guys. Okay, sorry. So they label this their pain as this much. Okay, and then they are asked to pick 4 colors and color in the picture of themselves with 1 color meaning no pain, another for mild, a third for moderate, and the final color to severe for severe pain. So they can pick whatever color they want first. So they would pick a color that would mean no pain, okay, and then a color for no pain, a little hurt, moderate pain, and severe pain. Okay, and then so they know that green means no pain at all, red means a lot of pain. They then color the diagram of themselves. Okay, they start with the part where they feel more painful. Okay, so here the doctor can see which part of the body they feel a lot of pain. Okay, so this is like McGill pain questionnaire but for children. It's more child friendly. Oh my god, guys, sorry. And the last one is Wong Baker scale. You've seen this a lot in the clinic. There's usually a big poster of it. Okay. Wong Baker faces rating scale uses a series of faces ranging from happy face at 0 to a crying face at 10. Okay, so the child chooses a face corresponding to the perceived pain. So let's say they go to the clinic and the doctor say, out of these 6 pictures, which one do you feel right now? Okay, so this is one way to measure pain in children. I am so sorry, guys. I've been coughing a lot, so I hope you understand what I was trying to say. If you don't, please text me and let me know what your question are. Thank you.